But hello everyone, how are you doing? Welcome to the third episode of the podcast Pets Talk Today. So now we're officially live this week. When we're recording this episode, our first episode was published, and then we're waiting for the next episode to publish next Wednesday, and this will be the third one. So yeah, it still doesn't have a lot of interaction, but that's expected. However, whenever you start coming and watching us, please let us the comments. Please give us some good reviews and let us know how we can also improve if needed. So yeah, today we're with the third episode that will be Vet 101, just like we said the last episode, and it will be what happened at a routine checkup. And then we're with Victor as always. So I'm gonna let him say hi and then we can jump in this episode. So
Hi
hi Victor, how
everyone.
are you doing?
I'm doing good. Thank you. Thank you for having me get back on the podcast. Hi everyone, and welcome back to our third episode. Hope you enjoyed our first two episodes, and now that we're live, I'm very excited.
Yeah, for sure. For sure. It feels really nice to be able to have like a project that we're creating and now we can see like how it is becoming a reality. So it's very exciting to be there. I'm very happy to be sharing with you guys this experience. And then let's start. I remember taking Nico to the bed couple times, maybe more times than expected. But there is always the same routine. I get there, they give me a place to be, like a little office. I go there with Nico, and then after a couple times some vet nurse or someone just come and take the dog to the other side of that back door that is behind the how you say that? Behind the
But in
room.
the back, yeah, the exam
Yeah, that
room.
is yeah, that is in the back of the room, and it is the exam room. So just when they take Nico out is the moment when they bring it to Victor. So Victor, what happened back there? What is the secret?
There's not really a big secret or anything. It's just when they take them to the back, they call it the treatment room or the treatment area. Is where they have all the equipment, more staff there, so they have more access to things, more diagnostic equipment and things like that. There's a lot of things they can do in the exam room, like physical exams. Sometimes they draw blood in the exam room. Sometimes the dog or cat is easy to work with in the back, and sometimes it's easier to work with them in the room with the pet owner or pet
Mhm.
parent. But yeah, it's not really anything secret. They have a table back there, usually, depending on each, every hospital is different. So, but usually it's a table. They have their syringes and just their normal things that they use for a routine checkup. Every time you come for a wellness visit, they might have to do heartworm tests on your dog or get blood for the chemistry panel, things like that. So they might have to take x-rays. So they have the x-ray machine back there or an ultrasound. So that's usually what's being done back there.
Okay, that's kind of cool. That's I don't know. I guess that for people living here in the United States all their lives, that's like a kind of normal thing. It
Mm-hmm.
was a little bit shocking for me when I get here because in Colombia it is like we have like the dog is with us every time when we go to the bed and the veterinarian like have everything in the room. But it was kind of surprising for me the first time they take my dog out. But I
Yeah.
guess here that's more common. So if I understand why is the reason why they take the pet to the back is not just because they have more equipment, it's also that it is that like related with the pet behavior is like they are more lean to behave better without the parents or
Sometimes they're so scared that they don't want to move when they're in the back. So sometimes they're even
Mhm.
more scared in the back. Sometimes the exam room with the pet owner is very cramped. If you have a big dog and you have the assistant, you have the veterinarian, you have the pet owner in that room, it's all cramped. Sometimes the animal can be more scared in the room compared to the back where they have more room to walk around, a more open area. But generally speaking, there is now a more push for less animals being taken to the back to reduce anxiety, reduce fear, and reduce stress in dogs and cats. So there's, like you said, in other countries, that's what they do more. They keep them in the room more often than take them into the back. But so yeah, there's a behavior component in that too. Like sometimes it might be they're not moving because they're so scared in the back, so they're not trying to bite or growl or anything like that, not showing the same fear that they are in the room. But that could be misconstrued as saying, oh, they're behaving better, but they're actually might actually be like actually more scared in the back, and that's why they're not having the same behavior.
So if according with that, we should be like sad to bring in the dog and bringing them to the back, or it have also more benefits? Because it sounds like a traumatic experience for the dogs, the way we're talking about.
It can be traumatic for sure, but I'd say it depends on the case because each dog and each cat is different. You know, each patient is different,
Mhm,
so you have to basically tailor the experience to every patient. So
mhm,
if one dog is really happy in the back and and maybe they're more, it's too crowded in the room and they don't like it, then
mhm.
you could take them to the back could be a good thing for them, you know. But if you
Okay.
see that they're more stressed in the back and you can do the same things in the room, then why not
Mm,
keep them in the room? You know,
okay.
sometimes the veterinarian or the technician or the assistant might be more stressed in the room themselves because now they have somebody there that's trying to hold the animal. The pet owner might be
Mhm,
trying to hold the animal, and there can be liability issues with that too. Because if let's say the dog tries to bite the pet owner, or the veterinarian could be liable for the
mhm.
injury.
Okay.
Even if that's their pet and they bite the
Okay.
pet owner, then that could be a big issue. So sometimes that also is a thing that it's taken into consideration.
Okay.
Yeah.
Well, I don't know, but at least in the case of Nico, I can say that my experience bringing the dog to the bed, and when they take Nico to the back, never gonna forget the first time I take him there. At that moment, Nico was like, he was like second day, third day I was with him. He was a scary cat when I bring him, and he was also like that scared that when I tried to bring him downstairs to walk or whatever, I literally have to charge him, like take him on my hands, put him outside, he poo, and then I have to hold it again back upstairs just because he was super scared. And I never gonna forget like that first time I bring it to the bed, because for me it was like something magical. I don't know what happened in that backside, but Nico was so scared, and I remember the technician coming for him, take him to the back, basically like how you say that, like pushing, no,
Pulling.
like pulling him out of the leash inside. And then at the moment he come outside, back outside, it was a totally different dog. He was walking, and then after I take him out of the bed, he actually learned how to walk in the leash while he was in there. So also I remember that when she was bringing him back, she was like putting a lot of treats in the floor, and he was just sniffing around. So it looks like it's not that the beds have like a lot of equipment. It looks like you also have a lot of treats back there, and that might make that terrifying experience a little bit better for the dog. I can say for Nico, that is normally a super scared cat, like a super scared dog. All the time I bring him there, he is actually like looking forward to getting there just to get the treats.
Yes, yes, exactly. Yeah, that's called positive reinforcement. Yeah, we do. That's what we try to do, at least in all points in the experience. Like at in the waiting room, in the exam room, in the back, giving treats to the dogs. As long as they don't have like a food allergy or something like that, then or if they're coming in for a GI issue, you don't want to be too much things that can upset the stomach. But
Mhm.
yeah, I'm glad that he had a good experience there. And that's crazy that just from one time going to the back and coming back in, that he's like a completely different dog. So that's
Oh
awesome.
yeah, 100% different. I remember after I bring him to the bed the first time, never have to carry, like I never have to put him on my hands again. He was just walking with the leash, and
Nice.
that was magical for me. I'm never gonna forget that. It was amazing. But then okay, we bring to the dog there, and now we learn that it is needed for the dog to go in the backside just because you have like all the equipment you need, and also you have the place where you hide the treats. What happens? So what is the steps that you follow, or how that works when you bring the dog
So
inside?
yeah, a lot of times the main thing they do is like do the physical exam. So if you're just going in for a vaccine visit, it's really important to have a physical exam with the patient. That's I think the main thing. And then depending on what the reason they're coming in, it could be to get also lab work done. So maybe they have to
Mhm.
get a blood sample. Maybe they're getting a urine sample or fecal sample, things like that for the tests that has to be ran. And usually they'll go over what they're going to be doing before they do it. They go over an estimate or go over like what the plan is,
Mm-hmm.
what vaccines they're doing, and things like that. So maybe they're doing some diagnostics like X-rays or ultrasound. So those are all things that they do in the back, or a lot of those things can be done in the room as well,
Mm-hmm.
depending on the place that you go to. Yeah.
Okay, so if I understand, you take the dog, the first thing you do is like a kind of simple examination.
Yeah.
How that examination work?
Yeah. So we usually they look at just like when we go to the doctor and the doctor examines us, we have
Mm-hmm.
the dog or cat examined by the doctor. So they look at their face, their eyes, their mouth, and they do a comprehensive exam. Even if you're going for something that's not related to what they're looking at, they still have to look at everything on the physical exam. So they're also palpating, like touching the belly, feeling the lymph nodes, listening to the heart with a stethoscope, listening to the lungs, moving the joints around, seeing if there's any signs of arthritis and things like that, looking at the skin all around, see if there's any redness or itchiness and things like that, signs of infection, anything that could be causing a problem. And oftentimes they're also taking their temperature, make sure there's no fever. If they're getting vaccines, you don't want to have a dog with a fever getting vaccines. So those are all
Mm-hmm.
part of the physical exam. And sometimes the technician or the assistant is the one that's also getting the heart rate, respiratory rate, and the temperature on the dog or
Mm-hmm.
cat. So that's getting done before the doctor is ready to see the patient. But that's usually the first step is the physical exam and then collection of the blood and things that they need to do for tests.
Okay.
Yeah.
I have a question, and it is okay. You find something in the dog. Then after that, the next thing you need to do is go outside and talk with the owner, right?
Mm. Yeah, they might, if they do, if oftentimes they're doing that in front of you, like the physical exam in the exam
Mm-hmm.
room. Sometimes it is in the back. But yeah,
Mm-hmm.
the next step is definitely talk to the owner about what they find, if there's any abnormalities that they find, for sure.
Okay.
And they
Okay.
say,
Is there? Yeah.
I was going to just say that oftentimes they tell us the most important diagnostic that we can do is the actual physical exam itself. That's how important
Mm-hmm.
it is because you can really catch things that are missed on other things. And
Mm-hmm.
that usually just our hands and our eyes or our ears are one of the most important things that we can be using to find.
Absolutely.
Yeah. And it's, as that's what we're trained to do, to try to find those things.
Mm-hmm. Obviously, you study for many years just to get there. Of course, that's like you're the expert. You are the experts in the matter. So that's actually the reason why we bring the dogs to the vet doctor, to the veterinarian. And then, do you have like any story that happened to you in there? Like, I mean, I'm
Yeah.
pretty sure that most of the time everything is yes, routinary. The pet owner bring the dog, you bring it inside. I mean, nothing will happen. But I am also pretty sure because if one thing I know about having pets is like always are crazy things going on. So,
Yeah.
do you have like any special or any kind of anecdote that you want to share or something that you remember that make you laugh a lot or something different?
Yeah. Yeah, I have one story that this one dog he was very aggressive, even with the pet owner, with the pet parent. He put the guy in the hospital. He bit his arm,
Oh, wow.
and yeah, and he had a scar running down his forearm, and he had to go
Mhm,
to the hospital. So I gave this dog a bath, and I was an assistant. I was not
mhm,
even in vet school yet. A long
mhm.
time ago, many years ago, and we had to get a blood sample from him. And looking back, we probably should have first do some behavior modification or some what we call pre-visit pharmaceuticals, which is basically drugs to help reduce anxiety in this dog. But what I was helping hold him, and then he tried to bite me a few times. And the person that was with me at the time told me, let's let go of the dog. So I let go of him, and he was extremely aggressive. He tried to bite me. There's multiple people in the room, but he only
Oh,
went
wow.
after me. I had to hide behind the table, and then he, would run around. And then I went into the backpack. We were already in the back, but I went even further in the
Mhm.
back and locked myself in the cage to get away from this dog.
Oh, wow.
So yeah, it was pretty bad. And he was able to get a little bit of my leg, but luckily he didn't break the skin. But yeah, that was a pretty scary moment.
I bet it was scary. I bet it was scary. But then
Yeah.
you were able to help the dog after that, or he was just in a crazy mood and they just need to take him out of the place.
Yeah, they had to take him out of the place. They had to call the owner. I think that dog was dropped off by the owner. So I think
Mm,
they had to call him to pick him up. Luckily, he did not hurt anybody, and
mhm.
I was okay. But it was pretty bad. I
Yeah.
think hopefully he did. I don't remember what happened after that, after they picked him up, but because it was like 9 years ago. But I
Mhm,
think he hopefully tried to improve his behavior through behavior modification techniques and
mhm.
hopefully some medications. Yeah.
Wow, well, that I'm bet if that something similar happened to me, I will be super scared too. Probably will be screaming around like crazy.
Oh yeah.
With the,
Yeah.
I can imagine like this moment with the dog behind you. That might be very scary. Do you have any other story like some funny stories to tell?
I got a funny story.
Okay,
Yeah, this one dog I was helping. I don't know if you're familiar with the anal glands. They're like these two things in the anus that the dogs have
okay,
that secrete
yes,
a smell.
those ones that stink terrible. Yes.
Yeah, sometimes they express them and then they have this terrible smell and it's a liquid that comes out.
Mm-hmm.
So this dog did that and I was helping hold him and he also urinated. And then his
Mm.
tail hit the fluid. Everything was mixed
Oh
together
man,
and it went straight in my eye. Like, why?
man,
His tail went into my eye with all that stuff in it. Yeah, pretty bad.
oh man, that
Yeah.
sounds terrible. You were stinking the rest of your day, or no?
Yeah, I had to take a shower. I mean, this is also a long time ago. This is probably around 8 years ago. Yeah. Had to.
Wow.
Yeah, it was stinky.
Yeah, you think you were helping a dog and it ends up being a skunk, huh?
Yeah, yeah, exactly. Oh my goodness. Yeah, it's pretty bad. But those are things that happen, at the animal
Mhm.
hospital. You have to just kind of deal with it.
No, okay.
Comes with the
And
territory.
no, I bet. Yeah, I mean, and it's not just like the pretty face of the animals. You also have like the other side when you have a lot of accidents going on inside, poop, peas. That's part of the work.
Yeah. Yep. Constant.
Yeah, 2 or 3 times a day, actually.
Yeah, on a good day. Yep.
So I don't want to ask in a bad day. I bet that well, Nico has like sometimes he get like terrible diarrhea, and
Mm-hmm.
sometimes I drop
Yeah.
him off in the bed because of that. I can't imagine how is their day cleaning after my dog. I'm so sad for them. And then I have another question, and it is. As a pet owner, and this is as a pet owner, most of the time you feel that your dog is sick, and you want to help your dog, but the first thing because for one side you want your puppy to get good, to get better, but in the other hand you also think like, okay, normally bringing my dog to the vet it might be a little bit expensive,
Mm-hmm.
and it is maybe not the first choice to say, okay, my dog is sick right now. When do you think, I mean, when your dog gets sick, there is something you can make at home in order to prevent, or in order to check on your own if the dog is can be like recovered with the time, with a
Mm.
little bit of time, or is most recommendable to bring the dog to the vet like immediately when you start seeing like some how do you say, I'm sorry, my English is a little bit
It's
broke
okay.
today.
Like something that tells you that your dog should go to the vet at that point, or
Yes, yes,
when
like,
can you just
yeah,
wait it
symptoms.
out? Symptoms.
Yeah, like
Okay,
for
yeah, yeah.
example, Nico it's a dog that sometimes he just stop eating, right?
Mm-hmm.
So I know that when my dog stop eating, for Nico it is like, okay, he has a problem, he has an intestinal problem, I have to bring him in. But for a normal dog, if they stop eating, normally the first reaction of a pet owner is not to bring him to the bed. So
Mm-hmm.
when is like that moment when you say, okay, it's time to bring him in?
Yeah, I would say depending on the problem, like for certain things, like if the dog has one bout of diarrhea, that's usually okay. Maybe the next time they go poop is be normal, and in those cases, it'd be okay to just wait it out. But yeah, if you're having like just one bout of diarrhea, it's okay. But it's like multiple
Mhm.
days of diarrhea, then that's when it's time to go to the vet. Or if they're having diarrhea and vomiting together, that's a sign. Not eating just for one day may be okay, depending on the dog. If you're talking about a puppy that's really small breed dog, eating one for one day can be a very big serious problem. So that's
Okay.
in those cases, because they're so small, they don't have a lot of fat
Mm-hmm.
reserves, and their glucose levels go down very quickly. So you don't want to
Okay.
be waiting too long for those dogs. But for the average, adult dog, especially the size of a husky, maybe eating
Mm-hmm.
just for one day, as long as for like, it's just the first time it's had this problem, you can wait it out a little bit, try to
Mm-hmm.
see what you can do. And if you're ever concerned, hesitate to call also,
Mm-hmm.
because they would, to your local veterinarian, they can also tell you, what's
Okay.
going on in your particular case, and tell you maybe this is a time where you can just wait it out, or maybe this is a
Mm-hmm.
time where you should bring them in. And there's not really a great set of guidelines to tell you this in this case is okay, and this time is we have to bring him into the vet. So I wish it
Okay.
was a clear cut answer, but it's kind of a lot of gray area
No, no,
in that.
that makes sense. Yeah, and then I'm pretty sure then there at least there are symptoms that are obvious. Like, okay, my dog has diarrhea for 3 days. Should I bring it? Yes, man, you have to bring it yesterday. So run
Yeah,
there, right?
yeah.
But there are maybe another kind of symptoms that are maybe not that easy to detect. Like,
Mm,
for example, how do you know that your dog is having like some, I don't know, like an ear infection or
hmm
something like that? Is there symptoms you can detect that are not that obvious? Maybe you say, okay, it's time to maybe call to the vet instead of going, but there is
hmm
something.
Yeah, I guess for the ear infection, I guess a big thing, allergies in dogs and ear infections go together very a lot of times. If they are seeing like redness around the ears, sometimes it's not easy to detect for a pet owner. But if you're really paying attention to those ears, you can see the redness before um, full allergy start, and like
Mhm.
more severe allergy symptoms. So those times you might be able to catch it before it gets a problem. Depending on, like, maybe you've already been, if your dog has allergies and they have ear problems, maybe they've already been seen for that problem at your vet,
Mm.
and maybe you already have some medications at home that you can maybe like a enzymatic cleaner or something that you can use at home before going there. But then if you catch it once it's already like they're shaking their head, they're scratching their ears, you
Yeah.
smell a bad odor. If you have like dark debris coming from the ears, then it's like that time, they probably need to be seen by the vet and figure out
Okay.
what's going on. Do some more investigation to find out what's exactly going on with your dog.
Okay, that makes sense. And then also to in the other hand, like to address like this fear that some pet owners might have about how expensive it is. And of course,
hmm
I know this is a subject to address in another whole podcast, but there are some like easy recommendations you can bring to the owners in order to, okay, you might be able to have a huge bill. You can, I don't know, get an insurance, or there is something like can help pet owners
Yeah.
to be more comfortable bringing the dog to the vet.
Yeah, I think insurance is a big thing. That's something that is pet insurance is getting becoming bigger and bigger now. I think
Mm-hmm.
it's very helpful. As far as I know, there's not really the pet insurance that covers pre-existing conditions. So you
Yes.
want to get it before they start getting diagnosed with anything. So it's good to get it early. Um, Especially it doesn't usually cover. Sometimes they cover wellness appointments, but usually they don't.
Mm-hmm.
The pictures help a lot with those sick visits or injuries. And then the other thing is this thing called Care Credit. That it's a medical credit card that you can use for humans and pets, and they help you like with decrease like interest rates. Basically, I don't remember all
Mm-hmm.
the back long time ago when I looked at it. It was like for bills of $200 or more, you get like 0% interest for 6 months.
Okay.
So that could help for some people. It's not the right choice for everybody. So you have to look into it more if that's what
Mm-hmm.
you're planning to do. And also keeping in mind that a lot of times catching things early is going to be
Mm-hmm.
more affordable than catching when it's a bigger problem. Especially
Absolutely.
prevention.
Okay.
Preventing things is always going to be more affordable. So you try to want to prevent things before they become a bigger problem and become more expensive for you.
Absolutely. There is also, and that's something that, for example, I have with my dog, and is some veterinary, some like vet clinics or something like that. They used to have like their own care packages, and that's
hmm
something that they just charge you like a monthly fee, and it's normally below $60 or something like that, and you get like free consultations. You get the shots, you get some of their blood and some of the tests that they need. So that's also a good recommendation if you're thinking that sometimes bringing your dog into the vet, it could be a little bit expensive and you're kind of scared of bringing the dog to the vet, that's also you can do when you go to the clinic. Just ask them if they have like these care packages, and sometimes, many times, they might be cheaper. Of course, if you see that your dog is mostly a healthy dog, and that might cause you like to think, okay, I might don't need that. That might be true, but that also is true that at any moment something can go wrong. And as Victor was saying earlier, some insurance doesn't cover any pre-existing thing, any pre-existing sickness. So it's better to spend a little bit more in front, even if you think you don't need it, because it's gonna be way cheaper after you need it. So I don't know if that makes sense.
Yeah, that makes sense. It does.
So yeah, that's few recommendations for you to have. In the case of Nico, he has the bed car care thing, and I promise you that I bring in Nico almost every month to the vet now for now, and it saved me a lot of money. So I would recommend everyone to have something like
Yeah.
that.
As in a lot of places they call it a wellness plan.
Yes, the wallets.
Hmm.
Yeah. All right. So let's see what else do I have to. Okay. So coming back, because we went so far from the theme we were talking today. Coming back. Okay. I bring my pet to the clinic. You take him back. You take him back to the backside. And then you come back and you have to talk with the patient. How is that addressing in the pet owner's concerns? How challenging it could be for a veterinarian? Like, I'm pretty sure that sometimes when I bring Nico in, sometimes the vet is like, I don't know, we need to make some tests, even if I want the answers now. How hard is sometimes deal with that pet owner concerns?
But yeah, communication is a huge thing that I think in medical field in general, that's a big thing that we have to improve on and continue to be conscious of. I think the one of the hardest things is to set expectations. Sometimes you say, we got to do these tests to figure out what's going on, we'll figure out what's going on with your dog or your cat, and in the dog and cat's not doing well, and tests may come back normal, and they're like, hold on, I just spent $200 on this test that just came back normal. My dog is still not doing well, and we still don't know what the problem is. So I think it's important to set those expectations and say, well, this test is going to hopefully give us an answer, but even if it comes back normal, it helps us rule out certain diseases. So even though we don't know what the problem is, even if it comes back normal, at least we have ruled out a lot of things. And sometimes there are conditions that cannot be cured. So we also have to set those expectations during our communication, saying, okay, what we're trying to do is manage the case. We're trying to manage this condition, but we may never be able to cure what's going on. So we're just trying to improve the quality of life or improve the symptoms. Sometimes we have to set also expectations of what can go wrong with procedures. Every time we go under anesthesia, there's a risk of heart problems, breathing problems, things like that. And death is also a risk in anesthetic events. So that's also talking about risks, talk about side effects, talk about all the things that can go wrong is important. And then you also don't want to be an alarmist. You don't want to scare them, but you also have to it's a fine line
Yeah,
balancing the
I
two
bet it is.
things. Yeah, talk about the risks and at the same time talk about what are the benefits of what we're doing. Nothing we do is benign. Everything can have a problem associated with it. So we want to be able to be transparent in those things, even with preventative things. Vaccines. They can have side effects of vaccines. They can have allergies to vaccines. They can be a little sore from the vaccination or have some swelling from the vaccination. So those are all things that we have to communicate while we're doing what we're doing.
Yeah. Have you ever been in a position, or when you have to tell like something hard to tell to the patients, to parents?
Yeah, there've been a couple of times, yeah, where I had to tell them when their dog had died, and I had to be the one that calls them. So
Oh my God.
there's been tough situations like that, or
Mhm.
to go over results of tests, and if they're not good news, sometimes I have to be the one that delivers that. But
Mhm.
sometimes I try to, I think people appreciate when you're honest with them. I think that's what I try to hold on to. Yeah.
Yeah. Yeah, I guess most of the times you always bring like good news, because when you bring the dog to the bed, normally vets find a cure. But yeah, I'm pretty sure that little moments when you have to tell the bad news, it might weigh more than giving a ton of good news.
Yeah.
And well, that's sad, but that's something that come with this office, like with this work.
Yeah.
Sometimes you can help the dogs, like that's true most of the time, but some other times is not that hard. It's not that possible, sorry. And that's, now that we're talking about surgeries, I might have another question, and it's okay. We already talked about
Mhm.
how is bringing the dog and what happened behind the back door when you're in, like in a normal check. But how is that process to prepare a dog or a patient, like a cat or an animal, for a surgery?
Mm.
Is
Yeah.
that I guess this is a different procedure, and I want to ask how that works.
Yeah, the very first thing is to, like we just talked about, communication with the owner. That's
Mm-hmm.
a huge part of it. Talk about what it entails is for step one, and talk about finances, of course, give it estimates
Mm-hmm.
and things like that. And depending on the procedure, things might be different, but in general, fasting the animals is important. Make sure that they don't have a lot much stuff in their stomach because the anesthesia can cause them to vomit or regurgitate during the procedure, and you
Mm-hmm.
want them choking on that, so we have to fast. And then the other thing is to do tests, like sometimes blood work, sometimes radiographs or x-ray images, to look at things before the procedure,
Mm-hmm.
so we know what the risks are before starting the procedure, because the drugs that we use can lower blood pressure. They can change the way the heart is beating, slow down the heart, so we want to make sure that everything is good before we start the procedure.
Mm-hmm.
And then once that happens, there are phases to medication. So the first thing, do a physical exam before giving medications. And then we do a pre-medication, which is usually injections. And that's going to sedate them to allow us to put an IV catheter to have IV access during the procedure for
Mm-hmm.
emergencies. And then after that, we induce them so that the induction agent or the induction medication is the one where we go to sleep to become unconscious. At that
Okay.
point, we usually intubate depending on the procedure. Well, if we're going to induce them, we have to intubate. So we put a tube down their trachea into their
Mm-hmm.
throat, the windpipe, and that gives us an open airway and allows us to also give gas anesthesia to maintain them under anesthesia. And that's when we monitor them for the procedure, monitor the vitals, their EKG, things like that. And then once the procedure is done, that's when they enter the recovery phase, when we turn off the gas anesthesia
Mm-hmm.
and allow them to slowly wake up and recover. And then we monitor them because that's usually recovery time. Is the recovery phase is usually the most dangerous part because we want to make sure that they're able to breathe during the recovery, and that's when we're monitoring them and waiting for the right time to take the tube out. Basically,
Mm-hmm.
extubate. Once that's done, they're awake, they're conscious, they're looking around. We make sure that they're not having signs of delirium or dysphoria from the medications.
What is, I'm sorry, what is dysphoria and delirium?
Yeah, so dysphoria is when they're like basically don't like confused. They don't know where they are. They could be
Okay.
scared. Sometimes it
Like
looks like they're
like when you went out, drink, and wake up in another house and it's not your house.
sort of like that, but sometimes they're screaming or yelling, and sometimes
Okay.
or they're just thrashing around in their area. So we want to make sure that they have a smooth recovery. So we'll
Okay.
sometimes use medications to decrease that dysphoric state. So basically, it's confusion and it's psychological, and
Mm-hmm.
it's just a part of the medications that we're using. Sometimes it doesn't happen all the time, and it doesn't happen, and it varies from dog to dog, from cat to cat. But yeah, after that, they're usually, depending on the procedure, they're able to stand up and already start walking around, and then we can go home. Sometimes the same day or the
Okay.
next day, and it's more intensive procedures. So you have to stay a few days before they can
Mm-hmm.
go home. Yeah, and
Okay.
then going home, we always have the pet parents watching them, seeing how
Mm-hmm.
they're doing, making sure that they're not going places where they can fall off, like because they're still a little bit loopy or drunk, from the drugs sometimes. So you don't
Yeah.
want them to fall down the stairs or something that are going to hurt themselves. Yeah.
Okay. What is the hardest procedure that you have to make so far?
The hardest procedure, I guess a spay is pretty hard. And I'm still in vet school, so I still have a lot
Mm-hmm.
to go as far as learning procedures. But I guess um, the hardest one I've done was a spay because that's an intra-abdominal procedure where you
Mm-hmm.
have to, it's a routine procedure that the average veterinarian does sometimes daily. So it's not like
Mm-hmm.
it just takes time to get it down. But yeah, it's a spay. Yeah, for me.
Okay. Okay. That's nice. You will be the best one doing that soon
Oh,
when you get
thanks.
a lot more experience. I'm pretty sure you're gonna be the best.
Appreciate that.
Yeah, and then I bet, and as you were saying at the beginning at the show, the episode, and also how now since we're talking about what is the walk through a surgery or a procedure that I'm pretty sure then the dog might be a lot super stressed during this process. How a veterinarian team can help to reduce that stress?
Yeah, so one thing is to, first of all, talk to the pet owner about it and try to do behavior modification techniques. So basically
Mm-hmm,
that's trying to make it more a positive experience, giving them treats or a toy to make
mm-hmm,
it better for them, reward so that they're not as fearful. So desensitizing them to what is going on. Um,
mm-hmm,
Also knowing what the threshold is. Once they show like very a lot of signs of anxiety, stress, and fear, and knowing
mm-hmm.
their body language, then we don't want to push them too hard and make it even worse. Because now we're making that fear even worse and worse each time.
Yeah.
Sometimes for a dog that's fearful, we can give medications to
Okay.
reduce anxiety before the procedure or before they're coming in for an appointment.
Oh, I have a question. What I remember when I get Nico, then he was like super scared. Now you can see him in the back playing a
Yeah.
lot. That was not his case before. I get like these gummies, or it was like these treats for dogs. Some of
Mm.
them were like with
The
hemp,
CBD.
yeah, the CBD with hemp extract. And there
Mm-hmm.
are also another ones that are just cold mint but without CBD. Are those supplements or are those like those treats helpful in cases like these, or they are not actually not strong enough?
So the CBD usually we there's not much that we know about it still. I can do a little bit more deep dive into the research to see what's out
Mhm.
there right now, but as far as I know, there's still a lot that we don't know about CBD, and it's still illegal for a veterinarian to sell it or
Okay.
to a lot of times we don't even talk about recommending them because I think if there's I don't remember all the laws regulating that, but
Uh-huh.
usually it's the doctors cannot talk about it as much as other medications, other things. But
Okay.
I can also there are also a lot of not regulation as far who's producing the CBD,
Hmm.
um, like what's in the medication itself. So one producer could say that it has 10 milligrams, but then we actually test the or I don't know how many, what's the normal dosage, but
That's actually true too for the human consumption one today.
mm,
That's a big trouble. For example, for those vapes that have CBD, because
mm,
it changes batch to batch, and there is like
mhm,
not regulation about what is the amount of CBD that it must have. So yeah, it's kind of the same, and that's something that is in the whole, let's say, pharmaceutical industry. And I say pharmaceutical most in the supplements industry. Like there is not a big regulation about CBD, and that's actually something that is not just happening in the United States, it's also happening in other countries. So that's like a global. I guess right now you see that like a boom, but at the same time it's just it's happening that fast and it's not giving enough time to the regulations, to the regulators to regulate how this industry is developing. But the question is more about like, okay, they are like supplements and treats. Do you
mhm,
think that bringing and not just the CBD, because for example I was scared to bring the CBD to Nico just because of that, so I get those that are more, they have like a different kind of, so one of them have like ashwagandha, I'm sure,
mm,
sorry if I'm not saying the right way, but it has ashwagandha, melatonin, and a couple other herbs, but the main purpose of that is like to calm him down, especially when he was like having the panic attacks at the beginning.
mhm.
Do you think this might actually help to, if, for example, if I know I have a super scared dog or a super reactive dog, use that kind of things before bringing him to the vet
Mm.
clinic? Or maybe it's better to use like something more regulatory, like like real medicines?
That's a good question. I think so. Ashwagandha, I don't know that much about it. In dogs, I've seen it,
Uh-huh,
heard about it used in people, but in
uh-huh,
melatonin, there is more research on melatonin though,
uh-huh.
and that's the only one I actually heard about with more research. But I don't know if use it by itself, so maybe use it together with prescription medications might be a
Okay,
good idea. There's a protocol called the chill protocol. I think it was developed in Cornell, a vet school. You can
okay.
might have to look a little more, but it does include melatonin in that protocol, and that's over the counter. supplement.
Okay.
There's a place for it. It doesn't work for every patient. Maybe it also
Mhm.
depends on the severity of their anxiety.
Mhm.
But I would always have the person talk to their veterinarian before trying them and see what they would want to do, because they might say, maybe this is not the best for your dog or for your cat.
Mhm.
But
Okay.
prescription medications like trazodone or gabapentin are often the first go-tos for those type of situations. And sometimes we
Okay.
have to add things, maybe mix things or see how your dog reacts to it. So like for
Mhm.
Nico, how does he behave like after you give the medication? Do you feel like that helps or for him?
Well, honestly, as far as I know, melatonin is good for induced sleep,
Mm-hmm.
just because that's the same hormone that we produce at nighttime, right before bed. And I can say at the beginning, I just when I give that treat to Nico, it was like he was just more relaxed, like more slowed down, like sleeping more. But to be honest, I just think that what I was doing is just helping him to sleep, like putting him like in this sleep mode, which
Mm-hmm.
at the beginning it was important for him just because he was having like a lot of stimulations. I mean, I guess I'm not sure if I already told. Yeah, I told that story last episode. With when I get Nico, he was in the crate for 6 months. He didn't know anything outside of the crate, and he was like scared of everything outside. And then, of course, when I get him, I mean, it was like take him out of that crave and show the whole world and everything, all that stimulations just come to him at the same moment. And he started having like panic attacks. So I guess like being in that sleepy mode might have helped him to experience those stimulation at the beginning. And I tried to be like very conscious of what I was doing, so I didn't give that treat to him like every time or every day. I
Mm-hmm.
normally use like half of a thing like in the nights when it was bedtime, and he was like most of the morning relaxed. But then after that, I used to take him in the afternoon kind of nights out to walk, just when I know that he doesn't have like was not under the influence of the thing, and I expose him to as many things as possible, like as many stimulation as possible, and then I just come back to him and I give him the treat. So after he was like on that super high peak of okay, I have a lot of stimulation, it was time for him to start calming down. And that was the way how I managed that. It was just like for a couple months after I just started reducing the melatonin and that treat, and he responded well. Also,
Okay.
something that helped him a lot was like when we walk outside, when I see that he start getting like super anxious, I just run with him. So I allow him to burn that energy in something that he likes than he was running. But that's something totally, I mean, that can help them like to get like positive experiences out of things. And then when it is super negative, then it's time to relax a little bit. But honestly, I don't know if that help. I will say I see how after 1 hour, half hour after I bring Nico the treat, he was just a little bit more sleepy. But I
Mm-hmm.
don't think that it was like a real calming reaction. I guess it was more like the melatonin acting, just putting him to sleep,
I see.
right? Just
Yeah.
like inducing the sleep.
Right. I think like it's still helpful as a sedative, so that
Mhm.
way if you have something that's scary for them, like if
Mhm.
I put myself in their shoes and say, "Oh, this is something
Mhm.
that's scary and I don't know what's going on," I'd rather be asleep for it.
Yeah.
So it also doesn't cause like a memory that's a bad memory for them at the animal
Mhm.
hospital. So the next time they go for a different reason, they don't have that bad experience that they had last time.
Mhm.
Of course, we don't want a dog to be like a zombie at home. So you
Yeah.
don't want like the same. You want to have a normal dog personality at home too. So
Mhm.
it's not something maybe it's something that you can use just for those experience times when they are going to the vet or something that we know that's gonna be anxiety. And I think it's like you said, like what you did with behavior modification. That's also really
Mhm.
important so that you can reduce that fear in them.
Yeah.
So it could
Yeah,
be a combination.
and I will say I use that with Nico that way just because I have experience with dogs that have a lot of anxiety and reducing like that thing. But if that's your first dog and you see that your dog is having panic attacks, I wouldn't recommend you to use like this kind of treats. I will recommend you to go to the vet and try to get some guidance on how to work. He might recommend to use these kind of things. Maybe he might recommend something stronger like gabapentin or whatever medication that the vet thing that the dog needs. But yeah, if you don't have the experience helping a dog to deal with that anxiety thing, I guess it's just better just to find some help. And then you can get the experience, and then when you have a next dog with situation like that, you're gonna have the tools, and you're gonna have the knowledge to help them. But if that's your first case, it might be actually bad for the dog. Like if you don't know what is the right moment to give this kind of helping, instead of helping your dog to feel the stimulation and process it in a good way, you might be just like numb him, or like just sedating him or her, and then the dog is never experiencing the stimulation that should experience, and the fear never gonna go away. So that's why it is important to be, I guess, with an expert before doing that kind of things.
If I can
Uh,
just add another also advice as well, is try to have times that they go to the vet, like a happy visit, where they're not really do anything at that visit. So they're not getting injections, they're not having things that could be more scary, and then make it a happy experience, give them treats at the time. So at that time they associate it with the good thing, especially with the puppy where they have not had those experiences yet. So you can give them more happy experiences before the actual appointment where they're getting the vaccination or their whatever it may be.
yeah,
Yeah.
absolutely. There is also some vet clinics. They also have like boarding
Hmm.
and daycare. And I guess that's the best way to give your dog a great experience, is bringing him to a daycare and the same place when they take. Not all of the clinics have daycare, but if your vet clinic have daycare, bring him at least 2 or 3 times. So allow your dog to go there and play just with another dogs, and that will make a difference on how your dog experience going to the clinic.
Yeah, for sure. Yeah, I think it's desensitization and having that socialization is important too.
Mm-hmm.
Yeah, for sure.
Yeah, well, I will say, Victor, we are already been talking for 1 hour. So,
Wow.
yeah. So, do you have any final thoughts or any comments to say in order to say goodbye to the people?
Well, I think my final thought would be to just not be scared to talk to your veterinarian about things like that. Like, be honest what your fears are when you're taking your dog. If you have concerns about your dog's anxiety or your cat's anxiety, just talk to them about it. And oftentimes, prevention is the best medicine. Preventing the problem before it becomes a bigger problem is going to be really important. And that goes with anxiety, and that goes with other things like any diseases like GI disease and things like that. So
Mm-hmm.
yeah, communication is key.
Yeah, it's absolutely. I would recommend you always need to have a veterinarian. Don't be scared to bring your pet to the veterinarian. Even if you think sometimes that it might be expensive, you also can let your veterinarian know that you're scared of that. And I'm pretty sure that they will find a solution that is not expensive. Right? So just do it. And if sometimes it is expensive because it has to be that way, well, I would recommend you also to get to the care plans, wellness clubs, get an insurance, all that things that can help you to reduce the bills will also reduce your anxiety, not your dog anxiety, but your anxiety to bring your animal to the veterinarian, and that way you can warrant that your dog is going to be healthy, because that's what everyone wants, is to have a healthy pet at home that you can enjoy and that can enjoy life. Yeah, and I guess that's everything we have to talk today. I will recommend you to stay here. The next episode we will be talking about pet behavior or pet nutrition. One of those will be the next one. It's still to be determined, but for sure I will say it will be a more happy podcast, because today we were talking about a little bit of sad things. But yeah, that's what happens when you bring the pet to the doctor. Normally, when you bring your pet to the doctor is because they are sick, and these kind of sad things happen all the time. We're gonna have surgeries, we're gonna have medicines, we're gonna have injections, and that's actually part of having a dog. Is not or a pet is not just staying with them when they're happy and everything's fine. It's also being for them when they are sick and helping them to get through that and be healthy again. So we talk a lot about it today. Also, if you have any questions for the vet, remember we're gonna have the section Ask the Vet, so you can let a question in the form that we have in the description. If you have any feedback, Also, there is a form for that in the description. If you want to come as one of our guests, there is a form in the description too. And finally, if you want to be one of our sponsors and we having us like promoting your product or your whatever you have, there is also a form in the description for you to contact us. And we don't talk much about that today, but we also have the newsletter that we send every week when we publish the podcast, when we send like more information about what happened and about what we talk. So for example, today in today's episode, we're gonna be also sharing like some pictures of how it is the backside of the veterinarian, like how is that exam room, that treatment room, and also sending another tips to get ready to go to the vet, to the veterinarian. So yeah, thank you so much for listening to us. Please stay tuned for the next episode. Don't forget to give us a review, subscribe if you're in YouTube, and bye bye. Do you have anything else to say, Victor?
No, don't forget to rate us and subscribe.
Yes, don't forget to subscribe. See you in the next week. See you the next week in the next episode. Have a good night.
Bye. Have a good night.
Bye bye.